Assalamu alaikum. So we are on cleaning, disinfection and sterilization of endoscope and its accessories. So in this presentation we will see how many type of endoscopes, how we will use the scopes and their cleaning mechanism and reuse for and between patient when we are reusing, how to store these endoscopes and its accessories, what is their cleaning and sterilization mechanism. So this is our aseptic module, and now we will see the cleaning, disinfection and sterilization of scopes and its accessories. So what is scope? What we can understand from the scopes. So scope is a long thin tube with a small camera inside called an endoscope. An endoscope is passed into the body through natural opening such as stomach. A procedure used to visualize, examine upper digestive system called endoscope. So how many types of scopes we have? Principally there are three main type of endoscopes, like the first one is endoscope, then colonoscope, then sigmoid scope. But if we will see, we have other types also. We have the scopes we have in other types also, which we are using for the different procedures. So endoscope which examines the esophagus, stomach and small bowel. Colonoscope which inspect the large bowel like colon. So sigmoid scope which view the sigmoid colons. Then other type of scopes are histoscope, visualizing inside the uterus, bronchoscopes to diagnose and treat lung problem such as tumor or bronchial cancer, like airway blockage, obstruction, narrowed area in airway stricture is called bronchoscope. So sequence of cleaning for endoscopes. And the sequence is like pre-cleaning. Soon after procedure finish, we should wipe the scope externally or clean the surface of the scope. Then after pre-cleaning, leakage test should be done. Then cleaning, again cleaning, then rinsing, disinfection, and then again rinsing and drying and storage. So where we are storing, where we are going to store this endoscope and how we will place this one. So in pre-cleaning, perform pre-cleaning of instruments at the point of use. So soon after, as I told before, that soon after procedure finish we should wipe or clear gross debris and visible particles from insertion tube with wet gauze. We have to clean this one. So flush air and water by pushing air water button. Then clear instrument channel by sucking enzymatic detergent through the working channels. Then perform visual inspection of insertion tube for bite marks. Detach scopes from light source and video processors. Transport carefully to disinfection room in leak proof and puncture proof container. So whenever we are doing any procedure in procedure room, after that the used equipment or used endoscope we must wrap in some sheet and then bring it to the dirty room where the cleaning procedure or other mechanical procedure will be done. So in cleaning, conduct leak testing and block testing. If leakage found, do not immerse scope in any liquid and don't use it. Again, keep it separate so other person by mistake will not prepare this device for another patient. Clean all surfaces with lint-free cloth or any sponge, or we can use immediately cleaning with the gauze piece also. Brush channels and valve cylinders also needs to be cleaned. Attached all channels, irrigators set to irrigate air, water and suction channels. So cleaning, we must be very careful that all the areas and all the accessories used during procedure should get passed through the cleaning mechanism. For ERCP, duodenoscope required an additional cleaning step. Elevate bridge upward and clean insertion tip with disposable handle brush. Attach flushing connector of elevator and inject water and detergent through syringes. So all this procedure for cleaning, it must be done by the trained technician or whoever is designated in this cleaning room. Renew the detergent solution for each new procedure. So whenever we are going to use this detergents, we should prepare new solution for new scope for their cleaning. Clean and rinse the container before the next procedure. So please don't forget for this one. Whenever you are cleaning your endoscopes or any used devices in any container, after cleaning this one scope, rinse and clean the container once again before you are going to start cleaning for another device. Rinsing is the endoscope and well under running filtered water. So make sure when you have done the cleaning for the endoscope, the rinsing water must be filtered or clean water. Immerse the endoscope and irrigate all channels. Discard the rinsing water after each use to avoid any contamination. Clean and rinse the container before the next procedure. Automatic processing. How we will do the automatic processing? So automatic processing, place endoscope and its all component according to instructions. Connect irrigation connector to the scope. Ensure all scope's surface are properly placed to avoid pinching and damage. And then start disinfection cycle. If cycle is interrupted due to any error or electricity, water supply or drain blockage, the disinfection process will be repeated. So make sure when you are working on the automated reprocessing, your scopes are going under the reprocessing mechanism. So if that machine or any automated machine stops due to electric interruption or any other reason, so the cycle should be restarted. You must repeat that process to give a proper time for its disinfection. Final rinsing should be rinse the endoscope and valve under running filtered water. Immerse the endoscope and irrigate all channels very carefully. Discard the rinsing water after each use. Then dry all the endoscopes after passing all this process. It must be dry. After disinfection and final rinsing, dry the endoscope with compressed air and rinse with isopropanol alcohol 70% for speed up drying and to protect recontamination. After all this mechanism, how we will store the endoscopes after cleaning. Hang preferably in vertical position and let it dry. Remove caps, valves and other detached components according to the manufacturer instructions. Uncoil insertion tubes, attach air rinsing adapter and activate switch. Use well ventilated room or cabinet to place these scopes. Major type of microorganisms. The first common microorganism is bacteria, or we can say bacterial infection. So bacteria are large in size than viruses. Bacteria are not between living and death. Immune system can recognize bacterial invasion. All the bacteria are not pathogenic. So bacteria are classified by shape and gram stain procedure. Okay, the second type of infection is fungus. The fungus are more large and complex in structure than bacteria and then mostly cause external diseases. Then the third one is spores. Spores are capsuled form of bacteria and fungi. All the bacteria and fungus don't have ability to come into spore form. In its spores forming, germs are highly resistant and difficult to kill than ordinary vegetated form. Then the fourth type is virus. Virus is simple and smallest form of life. All the viruses are pathogenic. Viruses are between living and dead, cannot move or reproduce itself, come into life only in host cell. There are two types of viruses, lipid and non-lipid viruses. What is microorganism? The microorganisms are who could only be seen under microscope are called microorganism. Ultrasonic cleaning. So ultrasonic cleaning for the other accessories we are using in endoscopy needs required the ultrasonic cleaning. It's mandatory also. Non-foaming detergent we should use during ultrasonic cleaning. Surgical accessories that penetrate the mucosal barrier should be cleaned ultrasonically, like biopsy forceps, guide wires, cytology brushes, and other cutting instruments. So all these things needs to be ultrasonic cleaning. Disinfection or high level disinfection. So disinfection is a process which provides general killing of viruses, bacteria and fungus, however not capable of providing efficacy against mycobacterium and spores. Disinfections can be achieved with boiling water, antiseptic solution, and then high-level disinfection. High-level disinfection is process which provide more than 99.9% coverage against all type of viruses, vegetative form of bacteria, including mycobacteria, fungus, but not necessary against spores. High-level disinfection can be achieved with chemical, dry heat and autoclave. What is sterilization? Sterilization is characterized by killing of all type of microorganisms, including complete destruction of mycobacteria and spores. Sterility is required in all forms of criteria. Sterility can be achieved by autoclaving, hydrogen peroxide, ethylene oxide, peracetic acid. Then what is body? Then cell is functional and structural unit of body. Then cell plus cell, when cells become together, become one tissue. Then tissues together become organ. Then when organs become on one place, it become a system. Then all systems together make a one organization or make a one body. How we can identify the disinfectants? Either it will clean or disinfect, or this is high level disinfection, or this will make sterilization. So there on disinfectants, the log number is always, we can see whenever we are using the disinfectant, if there is a log 1 or 2, if there is a log 1, it will clean 90%. If log 2, it will give reduction for the infection is 99%. If the log is 3, then it will be 99. And if the log number is 6 or 7, then that disinfectant, we can say that this is high level disinfectant. So whenever we are purchasing or using the disinfectants, we must see the log written on the container, that which log is written on the bottle, either it's low level disinfectant or it's high level disinfectant. So accessories we must disseminate, brush, flush and dry. So all the accessories we are using during procedures, it must be disseminate first, then flush all the organic material, then dry these accessories and pack and send for, if those accessories are for sterilization, plasma sterilization, send to CSST, and if not, we should do the use the high level disinfection. So this is one picture of endoscope. These are the channels. We can see it's very clear from where suction channel we can use, water channel where we can use, biopsy suction, how we can use this one. So this is very clear that how we can use the endoscope after using endoscope, how we can clean, how to flush, and hope you understand all the things in this presentation and you will work according to these guidelines. Thank you so much.